Welcome to 2-Minute MRCP. Today we'll quickly review cluster headache. Cluster headache is considered one of the most painful conditions a patient can experience. The name comes from its characteristic pattern. Headaches occur in clusters lasting several weeks, usually with the clusters occurring around once a year. It is more common in men, with a male-to-female ratio of approximately 3:1, and is more common in smokers. Alcohol may trigger an attack, and cluster headache also appears to be related to nocturnal sleep. Now, let's look at the key features. The patient develops intense, sharp, stabbing pain around one eye. Pain typically occurs once or twice a day, and each episode lasts from 15 minutes to 2 hours. Unlike migraine, the patient is typically restless and agitated during an attack because of the extreme severity of the pain. The clusters themselves usually last for 4 to 12 weeks. The headache is associated with autonomic features, including redness of the eye, lacrimation or tearing, and eyelid swelling. Other features include nasal stuffiness. A minority of patients may also develop miosis and ptosis. For investigations, most patients undergo neuroimaging, because underlying brain lesions can occasionally be found even when the clinical symptoms appear typical of cluster headache. The investigation of choice is MRI of the brain with gadolinium contrast. Now, management. According to NICE, specialist advice from a neurologist should be sought if a patient develops cluster headaches. For acute treatment, give 100% oxygen, which produces a response in approximately 80% of patients within 15 minutes. Another effective acute treatment is a subcutaneous triptan, with approximately 75% responding within 15 minutes. For prophylaxis, verapamil is the drug of choice. There is also some evidence supporting a tapering dose of prednisolone. Finally, remember the term trigeminal autonomic cephalalgia, or TAC. Some neurologists use this term to group conditions including cluster headache, paroxysmal hemicrania, and SUNCT, meaning short-lived unilateral neuralgiform headache with conjunctival injection and tearing. These patients should be referred for specialist assessment because specific treatment may be required. For example, it is known paroxysmal hemicrania responds very well to indomethacin. Thanks for watching 2-Minute MRCP. If you found this helpful, don't forget to like, share, and subscribe to 2-Minute MRCP for more quick revision videos.